Next up, we have Ricardo Villarreal, who is also running for Texas Congressional District 21. Mr. Real, you'll have Villarreal, you'll have 4 minutes for your opening statement, and then 90 seconds for a Q&A with the audience. It's all yours, sir.
Thank you very much for having me, K-Bad. Let me tell you a little bit about myself. I was born and raised in Laredo, Texas. I went to medical school after high school in Guadalajara. I practiced there for a couple of years, worked in the rural setting, had my office, was able to provide medical services to people that were less fortunate and were not able to afford healthcare. I worked for the Mexican government providing healthcare. After that, I came back to San Antonio. I got an MBA in healthcare administration from Our Lady of the Lake, and joined the Army Reserve, where I was an health services officer, where I served for 8 years. During that time within the reserves, I was mobilized to Fort Hood. I have the opportunity to travel to Fort Hood from San Antonio on a weekly basis during my mobilization and travel 281 for the whole year. So I got to know a lot of the Texas Hill Country through 281. That was a great opportunity to meet folks and be able to see everybody within District 21 and look at how our values differ from the current incumbent. And I'll go back to our values in just a little bit. In addition to being in the reserves, I work in different hospitals within the local community here in San Antonio. I also worked in Hill Country Memorial Hospital in Fredericksburg. So again, I have roots within the city in terms of healthcare and also in the rural community. My work there in the different hospitals has been in quality and performance improvement and patient safety. So bringing the best of healthcare to those that we are able to serve. Within the last 15 years, that's the kind of work that I've been doing. For the past 3 years after being mobilized, I was able to earn the benefit of the GI Bill, and that brought me back to school. I went back to school to get a second master's degree. That one was going to be in leadership. That was from Golden Gate University. And then after that, I jumped into a third master's degree in public policy from University of California, Berkeley. So when people talk about public policy, I've done my homework. I don't need to use taglines. I've done the policy analysis in all these different areas. I know what's affecting our community and our district. And lastly, the fourth master's degree that I'm actually working on is public leadership from the University of San Francisco, which is helping veterans like myself be able to jump into the public service, a second service to our nation that we've already served within the military. Now we're turning it into public service within the government. My priorities is healthcare. The previous speaker and question talked about COVID. I think that's one of the top line items for me. Within our district, we have over 8,000 deaths by COVID, and we have over 750,000 people that have been infected within District 21. That's something that the incumbent has consistently declined to comment on or acknowledge, and we can go into that. But I think that the biggest thing is that within District 21, we have over 90,000 people without health insurance, and that's unacceptable. If there was expansion with Medicaid, we'd be able to cover these individuals, and for the whole state of Texas, we'd be able to cover 1.4 million people that would be eligible under Medicaid expansion. Again, my focus or my biggest priority has been healthcare, but there's other things. I'm not a one-trick pony kind of person. There's a lot of things that, as a veteran, that's something that I want to work with in terms of being able to expand the benefits and all the different programs that are out there for veterans, being able to ensure that they have mental health care, that they have social services, and that we don't have any homeless veterans within our communities. Additionally, my wife is an immigration judge, so I'm pretty well versed. Again, being from Laredo, knowing about the border security and immigration, that's something that's a big passion for me. And having my mother be a Mexican immigrant, I think that's something that I want to be focused on and be able to work with on a bipartisan basis with Republican colleagues should I get to Congress. And with that, I'll open it up to your
Thank you, sir.
questions.
Thank you, sir. It is time for questions. If we have any from the folks who are watching the forum today, and I don't see any, so I'll ask you one myself. The incumbent, your opponent, has talked about his great support from veterans, and I've seen him, giving out the campaign information about working with the veterans and how much they like him. Can you tell me how much you work with veterans and what you'll be able to do for veterans?
So I've worked with veterans in different aspects, but let me back up a little bit. Our current incumbent loves photo ops, and he's the first person that's going to get in front of not just veterans, but Border Patrol and anybody that he can get in front of to be able to say that he supports their rights or their benefits. I think that's a disservice to our veterans and other and Border Patrol and Immigration Services, because one of the things that's constant is that he's voted against different initiatives or different bills that are proportional to those different communities. I can talk about him, one of 3 people voting against the ALS Act, a disease that disproportionately affects veterans, and he voted against that. So tell me how you appreciate law enforcement. How do you appreciate veterans if you're voting against their interests? I'm a veteran. I can talk to veterans, and I'm able to serve them because it benefits all of us.
Okay, thank you. I see no more questions, so you have about 20 seconds, sir, to give your final thoughts.
Absolutely. Chip Roy is running on healthcare freedom. I already talked about my priority in terms of COVID. Healthcare freedom is anti-mask, anti-vax. He talks about veterans issues. I'm a veteran and have seen it firsthand, the disservice he's done to us. He talks about immigration and loves taking pictures at the river, but he's done nothing about it except find a way to obstruct and not get anything done in terms of immigration. And he also talks about taking back schools, which is a code word for being against critical race theory and LGBTQIA rights for children.
Okay,
As a father of 2, I will do everything against Chip Roy and defeat him in November. He's someone that he does not want to face me as a candidate.
Thank you, sir. Thank you, Mr. Villarreal. We really appreciate your coming and joining us today. Thank you much.
My pleasure.